Hi guys, welcome. Thank you for listening in to this session, Pilates Basics and Introduction to Pilates. So what I'm going to do in this shorter session, this 30-minute session, is basically give you a brief introduction to Pilates, talk about what the principles are, describe some of the terminology that we use, and then we're going to practice a few of the things that we talk about, so that when you go into a class that's we've recorded the longer classes, that there's no confusion about what we're doing and all those sorts of things. So we'll just briefly go through some of the principles that Joseph Pilates sent out. So Joseph Pilates was the man who invented Pilates. That's why it's called Pilates. And originally it was a form of exercises that he used to rehabilitate soldiers. And it eventually evolved when he was a German man, eventually evolved when he migrated to the US and started using it to teach ballet dancers how to be stronger. And then gradually over the years evolved to what it is today. And now it's this very big industry. There's lots of different interpretations of the Pilates method, and there's lots of different ways to teach it. And that's why I think it's great for teachers to take the time to explain their interpretation, so that the people that they're teaching it to can get the most out of it. So I'm an osteopath. I practiced for 12 years. I don't practice anymore. I just teach Pilates, and I love Pilates because it's a really safe type of exercise for a whole range of people, right from 8-year-old up and coming athletes to 80-year-olds with low mobility. There's something for everybody in Pilates, and that's what I really enjoy about it. So we'll just quickly go through the principles of Pilates. So the first one is concentration, and it's a really important principle because there is a lot to think about in our classes, in these classes, and sometimes it can feel a bit overwhelming. But as long as you're trying to get one or two of the elements as you're going along, and the more you practice, the easier it'll get. Centering is the next principle. So centering is all about our center and our T-zone, or our powerhouse. Some teachers call it the powerhouse. But we're all talking about the same thing, and that's our muscles that we use in our pelvic floor and our deep abdominals, that we use in all of our Pilates exercises. Control is the next principle, and control and it sort of blends in with the next principle, which is precision. It's about being really controlled with all of our movements, being very careful with them, and making sure we're doing them correctly. So not worrying about how many repetitions we can get out, or how high our leg can go, or how much we can arch our back, or how far we can reach, or how heavy we have our weights. All of those things are meaningless if they're out of control or if you're not doing it precisely. So Pilates is all about control and precision in the movement, and that's what makes it so safe, because if you do the exercises correctly with precision and control, you shouldn't injure yourself. Breathing is the next one. So breathing is a really important Pilates principle. Life is breath. So with all of our exercises, we breathe quite deeply. And we always breathe in through our nose and then out through our mouth with pursed lips. And we breathe out through pursed lips because it helps us activate our center, our T-zone, our powerhouse. So we're just going to do a bit of an experiment now. So if you place one hand on your belly, I want you to breathe in through your nose. And then as you breathe out, just breathe out with an open mouth. And now we're going to have a practice breathing out through pursed lips. So inhale through your nose. And then as you exhale, breathing out through pursed lips. And what you should feel with that second breath, when you're having to force the air out from those pursed lips, not completely closed, but pursed, is that you'll feel your abdominal muscles switch on gently. So that's why breathing is so important. It works in with this centering principle. alignment. So every exercise we do in Pilates is aiming to normalize our spinal curves, and from an osteo's perspective, that's really important and really great. Flow, so the exercises tend to flow. One exercise flows into the next, so we're not going up, down, left, right, and making it really choppy. So we try and get a nice flow through the workout, moving from one exercise to another. And integration, so bringing all of those things together to produce this really amazing, safe workout that can also get you incredibly strong. So who can safely participate? Like I said before, it can be safe for people from the age of 8 up to the age of 80. It's not suitable for people who have got acute injuries, hot or swollen joints, who are heavily pregnant. So it's fairly safe in that. It's safe in that first trimester, and maybe partway into the second, depending on the level of comfort. But after that point, you should really be in a prenatal Pilates class where they can do more exercises designed for pregnancy. It's also not suitable for people who have had really recent surgery, or people who have got a lot of mobility restrictions, so you know, really unable to move a particular joint, or their back. So we're going to have a quick talk about spinal curves now. What we talked about in the Pilates principle alignment before, all of the exercises that we do in Pilates are aiming to normalize our spinal curves. So I'm just going to get my spine and show you what I mean. So this is a model of the human spine. So we have our pelvis down here. This is our lower back, our mid back, and our neck. And this up here is the base of the skull. And every curve, every part of our spine has a natural curve. So in our neck, we have a slight lordosis. In our mid back, we have a slight kyphosis. And then in our lower back, we have another lordosis. And for lots of reasons, you know, poor posture being one of them, these spinal curves can either increase or decrease and lead to pressure in the joints, muscle tightness, all kinds of issues with the spine. And so if you were to look at someone who had an increased lordosis and an increased kyphosis, so if they were hunched forward, that would look like that. So that increase in that curve in the spine. So all of our Pilates exercises are aiming to neutral, going into a neutral spine. And that's important when we do a lot of our exercises, because we talk about neutral spine and imprinted spine. So if we're going to talk about our center muscles, or our T-zone muscles, it's basically made up of, or we think about it in a T. So the vertical part of our T is our pelvic floor. So our pelvic floor sits underneath our pelvis, holds up all of our pelvic organs. And if we were to turn that on, we would think about trying to squeeze the muscles that we would stop ourselves from going to the toilet. So whether you're male or female, you're thinking about trying to squeeze it. If you imagine you're on the toilet, and as you want to stop the flow, and you squeeze those muscles internally. Now, it doesn't come from your glute muscle, so it's not from your bottom, it's an internal contraction. And then we have our transversus abdominis. So our transversus abdominis is a sheet of muscle that starts at the back, and it wraps around the front and into the front. And they're the deep abdominal muscles. So those deep abdominal muscles, if I can show you a picture here. So here we have, I think you can see that. So here you can see, this is the torso. So here you can see the six-pack muscles, or what people would call six-pack muscles. So they're those bumpy muscles in the abdomen that everybody strives to achieve in the gym to make you look like you've got a really strong core. And they're the most superficial muscles. And they look really good, but they don't do a whole lot in terms of stabilizing the spine. And they don't do a whole lot in terms of centering and strength. What we're really interested is in the muscles that are a bit deeper than that. And there's a couple of muscles that we talk about. So we have our internal obliques here. We have our pelvic floor, which we've already talked about. It's not in this picture, but it supports our pelvic organs. And then we have our transversus abdominis. So our transversus abdominis is deeper than all of those muscles. So deeper than our six-pack muscles, deeper than our obliques. It's in that deeper section, and you can see it here. So it's in the lower back, wraps around the waist, and attaches in through the front. So we're going to have a practice at activating those muscles now. And what I would like you to do is to lie on your back with your knees bent up, and you can put a pillow under your head if it feels more comfortable. I want you to have your knees bent up, and I want you, with your hands, just to find the bony parts at the front of your hips. And then I want you to place your fingers just to the inside of that, where it's soft, and gently press in. So we're going to have a think about that vertical part of the T first, so the pelvic floor muscles. So we're going to inhale through our nose like we practiced before. And then as we exhale through our mouth, I want you to just squeeze the pelvic floor. So don't do anything else. Just feel as though you're trying to stop yourself from going to the toilet. And what you should feel is that your muscles, there's a slight rise of the muscles underneath your fingers. So let's practice again. Inhale through the nose. And exhale, squeeze the pelvic floor. Good, let's have one more practice. Inhale through the mouth. And exhale, squeeze that pelvic floor. Good. Leaving our fingers where they are, let's think about that vertical or the horizontal part of the T, so that transversus abdominis, that muscle that starts in our lower back, wraps around our waist and attaches through to the front like I showed you in the book. So this time we'll still do our pelvic floor as we exhale, but as well as drawing up our pelvic floor, I want you to draw your navel in towards your spine and flatten through the tummy. And try to feel as though you're drawing those bony hip bones together. So inhale through the nose. Exhale, pelvic floor up, navel in, and draw those hip bones together. And what you should feel is that underneath the fingers, there's more movement. So there's more work. The muscles come up further. So let's practice a few more times. Inhale. Exhale, pelvic floor up, navel in. Inhale, relax. Exhale, pelvic floor up, navel in. And one more. Inhale. And exhale, pelvic floor up, navel in. Good. So that's our T-zone. T-zone, center, powerhouse, all of those terminologies we'll use throughout the class, and that's what I'm talking about. So now we're going to talk about spinal positions, and I'm going to bring back the spine for a minute and put it alongside me. And we'll try and line it up so that's the same as the spine that's on the mat. So when we're talking about spinal positions, you remember before I talked about neutral spine. So neutral spine is the natural normal curves of our lower back and the rest of our spine. So to find our neutral spine, we make a triangle with our hands and we place it on our pelvis so that our fingers are touching our pubic bone. So dig in a little bit, try and feel that pubic bone underneath your fingers, and your thumbs are meeting in the middle. And what we should do, if we've got a nice neutral spine, when we sit up and look down, we should see that our fingers and our thumbs are nice and level. So if I was to do it on the pelvis next to me, fingers touching at the front, thumbs meeting in the middle, and you can see my fingers and thumbs are nice and level. Now, if I had too much of a curve in my lower back, so if I put this spine into too much of a curve, you can see that my fingers are now lower. And if I don't have enough, you can see that my fingers are now higher. So this position with the fingers higher is actually imprinted spine, and we will practice that in a minute. But what I want you to do right now is to find that natural curve in the lower back, keep the tailbone down, and get those fingers and thumbs nice and level. So let's have a practice of that. Making our triangle, placing it down, feeling that small curve in the lower back, feeling the tailbone down on the mat, and lifting the head to look down, and making sure you make the adjustments. So now that we've got our neutral spine, we're going to practice imprinted spine. And the way we do imprinted spine is by using our T-zone muscles, so the muscles that we were just using before. So I want you to inhale through your nose, and then as you exhale through your mouth, pelvic floor up and navel draws in, and use your tummy to press your spine in towards the mat. So your fingers come higher than your thumbs. And then inhale back to neutral. So it's definitely not squeezing your glute muscles. Okay, anybody can squeeze their glute muscles and make those fingers higher. That's not what it's about. Our glutes stay relaxed. The movement comes from our tummy. So let's try a few more times. Find your neutral, inhale. Exhale, pelvic floor up, navel in, imprint the spine so you can gently feel the spine pressing into the mat, not shoving it in, just gently pressing. Inhale back to neutral. Let's do 2 more. Exhale, pelvic floor up, navel in and imprint. And 1 more, inhale back. Exhale, pelvic floor up, navel in and imprint. And release. Very good. So we're going to talk about body scanning now. So we use body scanning throughout the class to make sure that we're using our spine in the correct position. So we're always working with our spine in its most neutral, natural state. And we're using our muscles correctly. So for lots of reasons, we have imbalances in our muscles. A lot of the time it's due to poor posture. And so what we want to do with each exercise is making sure that we're practicing correctly to reverse some of those effects. So we're going to start with our head. And what we want to see with our head is that our chin is slightly tucked in and the back of the neck is long. So we shouldn't be seeing this with the chin jutting out. Sometimes if people have a really hunched through the shoulders, they have a lot of trouble doing this. And if that's the case, sometimes it's necessary to put a block, a yoga block, or a pillow under the head to get that chin into the correct position. So we want to be practicing strengthening through the front of the neck, lengthening through the back of the neck. So that's our head position. Our next position we need to think about is our shoulders. So always in Pilates, no matter what position we are aiming to draw our shoulder blades down and back. So if we were to place our hands by our side, I want you to take a deep breath in. As you exhale, strengthen that T-zone. So turn the T-zone and then wiggle the shoulders down away from the ears. Chin slightly tucked in. Good. So our head is in the right position with our chin slightly tucked in. Our shoulder blades are down and back with a nice distance between the ear and the shoulder. Our spine is neutral, so we've got a nice neutral spine with the tailbone down. And when we're in this supine position, so supine means lying on your back, our knees are in line with our hips and our feet are in line with our knees. So we haven't got our feet turned out or turned in, they're nice and in line. So we're just going to have a very quick practice of some curl ups now, just to get an idea of what we're doing when we're turning on our T-zone. So we're going to interlace our hands and place them behind our head, and we get our shoulder blades down and back. And we're going to practice a curl up. So our spine is still neutral. Again, let's do our body scan. Chin slightly tucked in, wiggle the shoulder blades down and back, spine is neutral. Inhale through the nose, exhale, pelvic floor up, navel in, and we're going to curl the body up. So we're drawing our tummy in as we curl. So in no exercise are we pushing out, we're always drawing in, like we're drawing up a corset. And then we inhale as we lower back down. Exhale, pelvic floor up, navel in and lift. Good, and inhale, lower back down. So generally in Pilates, the exhale is on the lift. And generally we have exhale on the effort. So we inhale as we're lowering ourselves and resting, and we're exhaling as we're lifting. And in most exercises, that's the case. There's a few where it's not, but in most of the time, if you're not sure, it's a pretty good bet that as you exhale, it's the effort part of the exercise. Let's do 2 more. Very good. Inhale and exhale. And inhale and rest. Very good. Bring those arms back to our side and wiggle the shoulder blades down and back to release. Good. So now we're going to talk about a few of the other positions that we use. So this is our supine, or our lying on our back position. We also do a lot of exercises in side lying position. So if we were to come to lie on our side now, we can talk about this. So usually with our side lying work, we have our arm extended above our head so that our head can rest on it. If you have any problems with your shoulder and you can't leave your arm in that position, you can bring your arm out in front of you and use a yoga block or a pillow underneath your head to rest your head on. We don't want the head to be resting down like that. That's just a recipe for a tight neck. So make sure your head is in line. And just because we're lying on our side now doesn't mean that our principles change. So we're still aiming for neutral spine, a normal curve in the neck, normal curve in the mid-back, normal curve in the lower back. T-zones are switches on, and I've got my knees bent in this position just so we can describe what we're talking about here. So when we're doing our exercises on our side, we still need to keep our shoulder down away from the ear, so we use our body scan the same way. This time when we do our T-zone, we still think about drawing our pelvic floor up and our navel in, but we also think about trying to create a gap between the waist and the floor. Now, it doesn't matter if there's not a gap there. I haven't got a gap, but it's that sensation of drawing our waist away. So not slouching forwards, drawing our pelvic floor up and navel in and our waist away from the mat. And what we want is to have a long line between our head, shoulders, hips, and in this case, our feet. So there's some exercises where our legs will be out long, but at the moment we're just leaving them bent. So we'll practice a few times. Let your tummy go nice and relaxed. Just place your hand on the hip and let's inhale through our nose. Exhale, pelvic floor up and navel in. Let's do 2 more. Inhale, release. Exhale, pelvic floor up, navel in. Inhale, release. 1 more. Exhale, pelvic floor up, navel in. Very good. So we're going to turn onto our back now and talk about tabletop position. So tabletop position is a position that we use when we're doing exercises on our back. So when we do tabletop, we can either do it with one leg or with both. If we're using one leg, we always use a neutral spine. So if I were to bring one leg into a tabletop position, our spine is neutral, knee lines up with the hip, and the shin is parallel with the ceiling like the top of a table. So that's our tabletop position. If we were to do an exercise with both legs in tabletop, that's quite difficult. You need to be able to imprint the spine. So what we're going to do is practice that. Now, if you can't maintain your imprinted spine, it's fine just to do it with one leg. So inhale through the nose, exhale, pelvic floor up, navel in, imprint the spine, and then that other leg can come up too. So now I have both legs in tabletop. Shin up, knee lining up with the hip, shins parallel with the ceiling. And then when I want to come out of tabletop, I bring my legs down one at a time, taking care not to arch the back. Good. So that's our tabletop position. 2 more positions to go over. So one, we do some exercises on our tummy. So we're just going to go over our T-zone activation on our tummy. So for this part, we'll stack our hands one on top of the other. We'll keep our head resting on our hands, and we'll talk about T-zone activation. Now we still do a body scan here. So we still have our chin slightly tucked in. We still have our shoulder blades drawn down and back, so we're not tensing our neck. And we're going to talk about our T-zone. So it's a lot easier when we're lying on our tummy for us to get soreness in our back when we're doing exercises. And quite often that's because people aren't activating correctly and they're arching our lower back. There's very few exercises where we really want that lower back to arch, because if we're using our T-zone properly, we shouldn't really get any movement through there. It should be mostly in neutral spine. So if we're going to practice neutral spine in this position, I want you to try to remember not to use your glutes. So keep your bottom muscles relaxed. We're just focusing on the tummy. So same as before, inhale through the nose. And then as you exhale through the mouth, pelvic floor up, navel draws away from the mat. And I want you to very gently press the pubic bone into the mat as you exhale. Inhale, release, let everything go relaxed. Let's practice again. Pelvic floor draws up, navel draws away from the mat, and pubic bone gently presses in. Don't use your glutes. It's from your tummy. Inhale, release. Let's practice again. Exhale, pelvic floor up, navel in. So you shouldn't be able to see me doing much here. It's all very internal at the front. Let's do one more. Inhale, release. Exhale, pelvic floor up, navel in. And release. Very good. Last position I want to take you through is 4-point kneeling. So 4-point kneeling, we have ourselves lined up nice and correctly here. So our hands are lining up underneath the line of the shoulders, so they're not too far in front of us or too far close to us. They're lining up in that correct position. We have our knee lining up underneath the hip. And again, we do our body scan. So our chin stays tightly tucked in. So a lot of the time when people are doing exercises, they end up looking away. So we don't want that. We want to keep the chin tucked in. We want to draw the shoulder blades down and back so we're not tensing through the neck. An extra note with our shoulder blades here is to make sure we're pressing away from the mat. So what tends to happen in 4-point kneeling is people allow their chest to sink in, and we definitely don't want that to happen. So just gently press away from the mat. And we need to try and maintain that no matter what we're doing. So if we start doing exercises with our legs or with our arms, we need to be able to maintain that press away, so without sinking in. Then our lower back, we still have that neutral spine. So if we've got our chin tucked in, we've got a little curve in our neck, mid-back, and we've got a little curve in our lower back. So we're not doing a cat stretch and tucking the tailbone under, and we're not arching our lower back and pressing our bottom out either. So we have that nice neutral position of our lower back as well. So that is 4-point kneeling. So those are our Pilates basics. I've gone through all of the major positions, some of the terminology that we talk about. I think I've remembered everything. I hope I have. I just wanted to quickly go over some of the equipment that we use. So we use in our classes small equipment, so things that you can have at home that aren't too difficult to obtain. So here we have a foam roller. So this is a 90 centimeter foam roller. It's a full roller, so it's not a half roller. And I'll put online the places where I get these items from. This is from a company called Access Health, so I'll provide the link for that because they're really good quality. We use leg weights. We can use leg or ankle weights to make exercises more difficult. So they just strap onto the ankle and they create more resistance or more weight, so that when we're doing exercises with our legs and feet, you can make it more difficult this way. This is our TheraBand. Now these come in different strengths. I like it on the firmer side, so I wouldn't go a really light one because I think they're a bit too flimsy. And generally they're about the length of the mat. So if you get a longer piece, you can trim it into two, so you've got two, but you can make them about the length or slightly longer than, slightly shorter than the length of your mat. That's also from Access Health, so I'll post that link as well. We also use free weights, so these are 2 kilogram free weights. In my classes we have 1/2 kilo, 1 kilo, 2 kilo, 3 kilo, 4 kilo. You can use whatever weight you want, but you have to remember your form, so there's no point in using a harder weight or a higher weight. If you're losing your form, you're losing your control, you're losing your precision. So we don't want to compromise any of those Pilates principles by trying to be really gung-ho and go with a stronger weight. You need to get the exercises precise, otherwise that can lead to injuries. And also these are the Pilates small balls. So these are 20 centimeter balls. They come with a little straw so you can self-inflate them. And I'll post a link for those as well. The weights are just from Kmart, and so are the mats. So they're nice and cheap from Kmart. They're great. So I trust that gives you a bit of a rundown about all of the exercises that we use in all of the basics that we use in our classes. We'll do certain classes with certain pieces of equipment and try and vary it up so that we keep challenging our body and challenging our brain in the way we use it in our Pilates classes, because it's not just body training, it's brain training as well. So yeah, I hope you enjoyed that. It's great to do this video, even for my regular clients that I've seen lots of times. Revisiting this stuff is really, really important. I still revisit it because even though I've been practicing for years, there's sometimes little things that I don't notice that I'm doing. And if I really concentrate and look inward, I can iron them out and then improve, in leaps and bounds. So whether you've done Pilates lots or you're just starting out, all of this stuff is really important. So well done. High five. Thanks for joining me, and I'll see you in a class another time. Bye.